Om Swastiastu, we are from SGD B2. Today we are going to present our student project presentations entitled Fat-Soluble Vitamins in Coronary Artery Disease. But first, let me introduce our team. And here is the outline for our presentations today.
Hello, my name is Dea Kalista Andana Putri with Relax Disease student number 129, and I will present you our student project introduction. First, about the background. Vitamins are essential micronutrients that cannot be synthesized endogenously by humans, which fat-soluble vitamins were found to play an integral role in an array of physiological processes such as immune function and regulation, vision, bone and mental health, and coagulation. Cardiovascular disease is a major concern for global health, which is the most common cause of mortality worldwide, with 17.9 million people died and 7.3 million of these deaths due to coronary artery disease. And recently, several new functions of fat-soluble vitamins have been reported to protect against cardiovascular diseases. Supplementation of some fat-soluble vitamins has been considered to reduce cardiovascular risk for hypertension, atherosclerosis, myocardial ischemia, arrhythmias, and heart failure. And here's our problem simulation. First, what is a fat-soluble vitamins? Second, what is coronary artery disease? Third, how fat-soluble vitamins play a role in the occurrence of coronary artery disease. And the last, how fat-soluble vitamins prevent and treat coronary artery disease. That's all from me. Next will be explained by my friend. Thank you.
My name is Gediaredi Farnanjaya, and the last digit of my student ID is 075. And this is our purpose and benefit of student project. The first purpose is to know what is a fat-soluble vitamin, and then to know what is coronary artery disease, and then to know the role of fat-soluble vitamin and its correlation and pathogenesis of coronary artery disease. And the last purpose is to know how to prevent and treat coronary artery disease with fat-soluble vitamin. And the benefit of this student project for medical student includes understanding fat-soluble vitamin, coronary artery disease, and the association between fat-soluble vitamin with the pathogenesis of coronary artery disease. Knowing the prevention of coronary artery disease by fat-soluble vitamin, and the management of coronary artery disease with fat-soluble vitamin. The benefit for the community is increasing knowledge to have a better understanding about fat-soluble vitamins in coronary artery disease.
My name is Susanna Pikira with the last digits of student number is 999, and today I will talk about the definition of fat-soluble vitamins. Vitamins are divided into two types, namely fat-soluble and water-soluble. Fat-soluble vitamins are stored in the liver and adipose tissue of human body. Fat-soluble vitamins are A, D, E, and K. Vitamin A is divided into carotenes and retinoids. Carotenes are found in plants and retinoids are mainly found in animals. Vitamin D is sorted into vitamin B2 and D3. Vitamin B2 is sourced from tuna and salmon, and vitamin D3 is synthesized by the body after exposure to the sunlight. Vitamin E divided into two groups, namely tocotrienols and tocopherol. Vitamin E is sourced from whole grains, nuts, and vegetable oils. Vitamin K is categorized into two, namely vitamin K1 and K2. K1 is found in cauliflower, green vegetable, and cabbage, meanwhile K2 is mostly synthesized by anaerobic intestinal flora. Thank you.
First, let me introduce myself. My name is Danisa Putri Dita with the last digit number 005, and today I will explain about coronary artery disease. So, coronary artery disease itself is a common cardiovascular disease that involves arteriosclerotic plaque formation in the blood vessel. The arteriosclerotic plaque itself occurs due to accumulation of LDL in the intima of the coronary vessels, which later this accumulation can be scavenged by the macrophage and will lead to the foamy cell formation. So for the clinical presentation itself, it includes ectopia pectoris, fever, shortness of breath, and etc. In 2020, Kemenkes has reported that the number of deaths caused by coronary artery disease in Indonesia is reaching 1.25 million people. And for the treatment of coronary artery disease include non-pharmacological, pharmacological, and surgical. For the non-pharmacological management, it includes diet and lifestyle management, and this management should always be considered necessary for all coronary artery disease patients. So that's all for me. Thank you.
My name is Stephanie Ecclesia, and the last 3 digits of my student ID number being 127. Now I'm going to be explaining about the role of vitamin A in the pathogenesis of coronary artery disease, or CAD. Production of ROS and lipid peroxidation plays an important role in CAD pathogenesis. Vitamin A has essential purposes in CAD development through its antioxidant properties, although it is still debated whether vitamin A is considered as antioxidant or not. Some studies also revealed that CAD patients has lower serum vitamin A levels compared to healthy person.
Let me introduce myself. My name is Dennis Vijay with the last 3 digit of student number is 037. Now let me continue the presentations of vitamin D and CAD. So the golden standard to assess vitamin D deficiency is using the serum calcidiol. A range below 75 nanomole per liter or less than 30 nanograms per milliliter is considered as vitamin D deficiency. Vitamin D deficiency is one of the most global health issues. It is estimated about 1 billion people of worldwide populations has vitamin D deficiencies. Some regions and ethnicity are prone to vitamin D deficiency because of their habits and lifestyle. And some communities are also prone to vitamin D deficiency, such as people with obesity, nursing home residents, and also hospitalized patients. Vitamin D pathogenesis works by angiotensin 1 expression inhibitions, transformations from angiotensin 2 to angiotensin 1,7 that will result in antifibrotic, anti-inflammatory, and induce the antihypertensive effects, and disruption of B cells activations in epicardial adipose tissue cells resulted in reduced atherosclerotic process progressions. That's all from me. The next one will be explained by my friend. Thank you.
My name is Josephine Rida with the last 3 digits of ID number is 094. Vitamin E roles include antioxidant effect, immunomodulation, and antiplatelet effect. Insufficiency of vitamin E often leads to neurological symptoms like ataxia and motor skeletal myopathy. Chronic vitamin E deficiency can cause impaired immune response, hemolytic anemia, and dermatological disturbance, such as dry skin, cracked skin, and premature aging. Vitamin E deficiency is primarily caused by inadequate intake or body's inability to absorb it. Common cause of vitamin E deficiency in developed countries include premature birth with infants, impaired fat metabolism, cystic fibrosis, chronic cholestatic hepatobiliary disease, Crohn's disease, and isolated vitamin E deficiency syndrome. In developing countries, inadequate intake is a major cause of vitamin E deficiency. That's all from me. Thank you.
Hi, my name is Gwen Felshaudan with student number 110, and I'm going to continue about the vitamin E correlation with CAD, or coronary artery disease. In Indonesia, the incidence of vitamin E deficiency is not quite clear yet, but a study has shown that 52.28% of pregnant women suffers insufficiency of vitamin E intake. The vitamin E group consists of alpha, beta, gamma, and theta forms, while with alpha tocopherol, the most significant and abundant in humans. Vitamin E supplementation in hypertensive patients has shown mixed results. While some can lower blood pressure, some results shown that there is no effect at all. Vitamin E also has a unique anti-atherosclerosis properties and also can protect against inflammation, the two of them being one of the pathophysiologies of CAD. Animal studies has shown beneficial effects of vitamin E on atherosclerosis vascular lesions and also reducing cholesterol-induced atherosclerosis. The same cannot be said in clinical trials. In clinical trials itself, clinical trials on vitamin E's roles on atherogenesis in humans have mostly yielded negative effects, but there is also potential for its future as a prevention method where it is beneficial. Thank you.
Hello everyone, my name is Ana Agung Istiarandeni with my last 3-digit ID student number is 233. Now I will explain about the vitamin K and CAD. Vitamin K is one of the fat-soluble vitamins. Vitamin K is divided into 3 main groups, namely K1 or phylloquinone, vitamin K2 menaquinones, and vitamin K3 menadione. In general, vitamin K functions is to activate proteins that plays an important role in bone formation and blood clotting. In addition, vitamin K, especially vitamin K2, has also been shown to be able to maintain the health of the cardiovascular system with various mechanisms, including reducing systemic inflammation, maintaining homeostasis, and preventing narrowing of the arteries that can occur due to the fat deposits such as CAD or coronary arterial disease, which is mediated by increasing activation of MGP or matrix blood protein. Maybe that's all I can say, and for the next explanation will be explained by my friend. Thank you.
Hello doctors and friends, my name is Christina Natalia with the 3 last digit student number 109. Now I'm going to present about the recommended dietary allowances of fat-soluble vitamins. So in this part of student project, it is classified into 4 types, which is the vitamin A, vitamin D, and vitamin E, and vitamin K. The vitamin A on this first slide is classified from the birth to 6 months until over 51 years old. And then it's continued to the vitamin D table, which is classified from 0 to 12 months until over 70 years old. And then the next one is vitamin E table, which is classified from 0 to 6 months until over 14 years old. And then the last one is vitamin K, which is classified from birth to 6 months until over 19 years old. Each dosage can be seen on the table. And that's all from me, thank you.
My name is Diana Ningrum and I will explain about the prevention of CAD by fat-soluble vitamins. Vitamin A and its precursor like alpha-carotene and beta-carotene have positive effect on various cardiovascular-related diseases, such as coronary artery disease, which is thought to be the effect of its antioxidant and anti-inflammatory properties. Meanwhile, administration of vitamin D has been shown to benefit in hypertension and heart failure with its mechanism in smooth muscle cells. In several studies, it is known that there is an inverse relationship between the increased level of calcitriol precursor and a reduced risk of cardiovascular disease, one of which is the coronary artery disease, but it is currently undergoing further observation. Due to its low health risk, vitamin E is currently the most widely used nutritional supplement. Research has also revealed that it is reducing coronary artery risk in men along with experiments on rats. But on the other hand, high doses of vitamin E are also associated with an increased risk of coronary artery disease. Since current studies still show conflicting results, further studies are needed regarding the dose given.
Hello everyone, my name is Grace Valerie with the last digit number of 143, and in this presentation I'm going to present about fat-soluble vitamin supplementation recommendation for managing coronary artery disease. So the first one is vitamin A and its precursors, which include alpha-carotene or beta-carotene, which are favorable in development of cardiovascular diseases. The second one is vitamin D or calcitriol, which results in depletion of progression of coronary artery disease and acute myocardial infarction, lowers serum levels of total cholesterol, triglycerides, and low-density lipoproteins, as well as increases high-density lipoproteins and endothelial nitric oxide production. The third one is vitamin E. Vitamin E, when given at least 100 international units per day for 2 years, reduces coronary artery disease risk, and if given more than 400 international units per day, can increase all-cause mortality. Last but not least is vitamin K, which includes both vitamin K1 and vitamin K2, which reduces systemic inflammation, maintains hemostasis, as well as inhibits arterial calcification. That's all from me, thank you.
Hello doctors and friends, my name is Christina Natalia with the 3 last digit student number 109. Now I'm going to present about the method of journal searching. In the writing process of this project, authors use the literature review method for writing these articles with the keywords fat-soluble vitamins, coronary artery disease, vitamin A, vitamin D, vitamin E, vitamin K, and Boolean logics, and to retrieve scientific journals. Retrieval process are conducted with 3 databases, which is Google Scholar, Science Direct, and PubMed. The data retrieved are collected systematically related to the issues discussed in this project. Thank you.
My name is Stella Angelini Spianto and my last 3 digits are 142, and now I will present about the conclusion of our student project. So, fat-soluble vitamins are known to be beneficial in coronary artery disease. There is vitamin A by its antioxidant properties, vitamin E by its anti-atherosclerosis properties, and interaction of vitamin D and its receptor in disrupting NF-κB activation in epicardial adipose tissue cells, which resulted in reduced atherosclerotic process progression, and vitamin K by increased the activation of vitamin K dependent protein, which resulted in decreased coronary artery calcification. Fat-soluble vitamin supplementation, vitamin A, D, E, K intake is believed to prevent or reduce the development of CAD, but further studies are needed to determine the dosage.
So that's all about our presentations about fat-soluble vitamins in coronary artery disease. We do apologize for any mistakes during the presentations. Thank you for your attention, and I'll close the presentations with Paramasanti. Om Santi 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 Om.